Public Fund Health Policy Analysis Center was created on July 17, 2009. It is a legal successor of the Health Policy Analysis Project, launched in 2000 on the initiative of the Kyrgyz Ministry of Health with technical and financial support from the World Health Organization and the Departments for International Development of UK. Development of the health policy analysis function became an urgent necessity and responded to the demands of the time, since Kyrgyzstan embarked on a comprehensive healthcare system reform, which involved not only organizational and structural changes, but also changes in health financing system, human resource policy, clinical practice, and many other aspects. The National Healthcare Reform Program developed by Kyrgyzstan reflected priority goals and objectives for the step-by-step implementation and were supported by the World Bank, WHO, and other international agencies. The idea was to have a monitoring and evaluation components to routinely track outcomes of the reforms, bring changes not only to the content of the evaluation frameworks, but also to strengthen the sector's capacity in applied health policy research.
In 2000, with WHO and support from the UK government, we started the Health Policy Analysis Project in Kyrgyzstan, and also to get agreement that this was going to be different in terms of how research worked in the country, because Kyrgyzstan, like many countries that emerged from the Soviet Union, didn't really have a tradition of applied policy research. It was more basic science, and what people who've worked in other parts of the world knew was that there's always some difference between what's designed on paper and how things work in practice. And that doesn't mean that anybody's to blame, it's just how things are. And the idea is that you design something, you implement, you learn, and you adapt. And that learning and adaptation I wanted to get into as part of the regular functioning of the health system.
Establishment of the Health Policy Analysis Center in 2009 ensured the sustainability of the capacity, build and experience gained within the WHO DFID project for implementing the health policy analysis function in the Kyrgyz Republic. Mission of the HPAC is to support evidence-based decision and health policymaking. The center has 4 key areas of activity. It conducts health policy research jointly with both local and international partners, organizes and delivers training on monitoring and evaluation, health management, health systems development and strengthening. It also delivers consulting services in Kyrgyzstan and some countries of Central Asia, as well as organizes policy dialogue.
После того, как были проведены эти все исследования, их необходимо было предоставить более широкой аудитории.
Once all these studies had been conducted, they needed to be presented to a broader audience. And one of the most significant events held as part of the policy dialogue was a series of joint reviews with the Ministry of Health, which brought together all policymakers and development partners. Various issues were discussed there, as well as research findings were presented at these joint reviews. Of course, there were many other roundtables.
Совместных обзорах. Безусловно, было много различных других круглых столов.
Currently, Health Policy Analysis Center continues to work closely with government agencies, Ministry of Health and its subdivisions, Mandatory Health Insurance Fund, health facilities, international projects and development partners implementing programs in healthcare and other social areas, as well as research agencies, consulting companies, NGOs, academic and research communities, foundations and universities. The center conducts monitoring and evaluation of the health system reforms, programs and projects, prepares analytical materials and supports government agencies in developing mechanisms for implementing policies based on the research findings. Up to date, more than 90 health policy studies have been conducted in the following areas: poverty and equity, health financing, health system performance, health service delivery, human resources and public health. The center conducts training on monitoring and evaluation. It delivered dozens of courses on health management and since 2004 had been organizing and conducting international flagship courses on health system development, financing and strengthening for the post-Soviet and other countries: Central Asia, Caucasus, Moldova, Ukraine, Russia and Mongolia, in partnership with the World Bank Institute, WHO Regional Office for Europe and WHO Barcelona Office for Health System Strengthening. The center coordinated efforts on creating a network of national health accounts for the CIS, conducted GVHSS assessment in Kyrgyzstan, as well as developed a package of indicators for monitoring the health system performance and implementation of the national reform and development programs. The HPAC team was involved in development of the national health reform programs Manas Ta'alimi and Densoluk, the government program for the pharmaceutical sector development, the national mental health program, as well as the program of the Kyrgyz Republic government on public health protection and healthcare system development for 2019-2030 Healthy Person Prosperous Country. The center regularly holds roundtables, seminars and other events dedicated to the research findings and current health policy issues. Their goal is to promote information exchange, open debate and consensus building to support policy dialogue on critical health issues.
Everybody's a specialist and basically people all work in their narrow areas, and that now we have to work across and also dealing with the concept of uncertainty. I think that's one thing. The other thing, and quite concretely, was something I had to learn, and it was a difficult lesson, but I was saved in a way which had to do with the importance of not only the right research and relevant research, but also timely research. It was an important lesson, basically, to say that it's not just important to have the right design, that if you need to respond to decision makers, you have to be timely, right? And one thing I've learned, and I recommend this a lot of other places, is that even though the quantitative research which we did became important the next year, you have to always do this rapid appraisal, early kind of work, because government and the people need to know how it's going. It may not be fully representative, but it's still very important. So that lesson about timeliness, I think, was very important in terms of how to make it work. What I guess we were trying to do, and it's hard to measure, is to try to change the culture a bit of the health system to one that is less certain about everything, that is less purely scientific, if you could say that, and recognize that there's a lot of social science that goes into understanding policy and policy change and reform. To my understanding, that change has happened. You know, it's evolved in ways we couldn't have anticipated, in a sense, but still very importantly. In the program, there was I believe, a regular, and something that Melita could speak more to, regular reporting in the meetings of the ministry and the staff with findings from applied research, right? And I think these things became important, that people were starting to ask questions about, we need to study on this or that, because they couldn't be certain of everything. And I think that kind of, in a way, getting people more comfortable with uncertainty was a big part of I think, what we were able to accomplish in creating, in a way, new institutional processes and mechanisms beyond a kind of just a purely rigid bureaucratic approach.
Overall, a significant contribution was made to the research capacity building, both for the HPAC team itself and for many other professionals working at different health system levels through participation in various international conferences, trainings and seminars. Contribution of the Health Policy Analysis Center to the health system development has been highly appreciated by the Ministry of Health of the Kyrgyz Republic. In addition to its key activities, HPAC has been implementing 2 projects. The AXIS study project, addressing the challenge and constraints of insulin sources and supply, 3 phases from 2017 to 2027. As part of the project, For the first time in Kyrgyzstan, clinical guidelines and protocols for type 1 diabetes were developed and approved, as well as clinical guidelines and standards for the nursing process in diabetes have been implemented. Nurses began to actively participate in education of patients during consultations and visits, and their work has been reoriented towards early detection and prevention of diabetes. Within the frames of the non-communicable diseases policy lab project, efforts are aimed to strengthen the capacity to improve the decision-making process and policy development based on evidence and reliable data.
У нас есть достоверные данные, результаты исследований определенных.
When we have reliable data and research findings, we understand the situation better. This means that decisions are made based on proven facts, rather than intuition or pressure from circumstances. In recent years, the Ministry of Health has been relying on the results of national studies on vaccination coverage and analysis of the reasons for refusing vaccination. Based on this information, we have revised communication strategies, concentrating our financial and human resources on specific groups and regions. As a result, we have managed to increase vaccination coverage amongst children and reduce the risk of outbreaks of controlled infections.
Соответственно, снизить риск вспышек таких управляемых инфекций, как, например, корь.
В настоящее время все больше приобретает актуальность и значение.
Currently, evidence-based decision-making is becoming increasingly relevant and important. All parties understand this, including our partners in government agencies. Therefore, the need to provide evidence is increasing. However, the issue of interaction between data consumers and providers still remains. This interaction is, let's say, quite random. Work is currently underway to systematize this process in order to make it more open and transparent. And now we are trying to help the Ministry of Health develop a mechanism that will allow us to coordinate this process. We want to involve all stakeholders in this process, which will be open to everyone, meaning it will be predictable. We propose that the Ministry of Health develop a strategic plan for research activities, which will subsequently be open to all parties, both for those who conduct various studies and analysis and for those who support such work, that is, our development partners. This will enable all parties to plan their activities, see where they can be most useful. We believe that introduction of such a mechanism in the future will increase the effectiveness of interaction between data consumers and data providers.
Активное взаимодействие между, как я говорил, потребителями данных, так и поставщиками.
Currently, the HPAC continues its active work, liaises with partner organizations, and is open to new cooperation while adhering to its original principles. We involve policymakers at all stages of the research and analysis process. We work in teams, often in collaboration with other governmental, non-governmental, and international agencies. We believe that we are useful as long as we stay independent and unbased in our professional analytical judgment. We are open and make decisions based on joint team discussions.